Dr. Haymart, with your involvement in creating thyroid carcinoma guidelines and your research on optimizing cancer care delivery, what recent advancements or changes in thyroid cancer management do you find most promising for improving patient outcomes?
So I think there's a lot of exciting changes that are coming. But the one that I'm most excited about with the guidelines is the guidelines are going to emphasize tailored care more and shared decision making more. And so I think these are key. And so for a lot of thyroid cancer management, there is not one right or wrong treatment option. It depends a little bit on the patient and what their preferences are. And so for preference sensitive decision making, there's going to be a lot more emphasis on including the patient in that decision making. There's no right or wrong choice. The patient can think about what concerns them the most and then prioritize things based on that. So for example, total thyroidectomy, which means removing all of the thyroid, versus lobectomy, which removes half the thyroid. For some patients with low risk disease, either option is okay. The benefit of doing a lobectomy is there's less surgical risk, so less risk of voice problems, less risk of low calcium. The disadvantages is that sometimes there's more follow-up needed, maybe more ultrasounds needed. You don't know by blood work necessarily that all the cancer's gone, so you get more information by doing a total thyroidectomy, but the total thyroidectomy has more surgical risk. So for example, if someone is a singer and they really don't want their voice to be damaged and they're not that worried about cancer coming back, lobectomy might be the choice for them. If someone has a lot of anxiety about wanting to know that absolutely everything is gone, and the idea that they might need more ultrasounds makes them anxious, maybe total thyroidectomy would be a better option for them. And so moving forward, I think there's going to be this emphasis on personalized care, shared decision-making, and sort of tailoring the care to the patient. And so my activation tip for this question is that patients should carefully ask the risk and benefits of each of the treatment options so they can make a pro-con list for themselves, and really tailor it to what's a priority to them.
Okay, thank you. And one follow-up question I have to that as a cancer patient myself is whether a patient and their doctor chooses a more or less aggressive treatment with their thyroid cancer, what does the follow-up look like? Are labs and imaging done forever for that patient to make sure there's not a recurrence, or is it just for a certain period of time?
So this is a great question. About, I don't know, 10 years ago, everybody was getting almost the same treatment, right? So we've started to tailor it more, and there's far more people getting lobectomy now than they were 10, 20 years ago. Which is great. The disadvantage is we don't have as much long-term data on these individuals. And so it's a little hard to be conclusive about when is the right time to stop follow-up. The longer we get out, the more data we'll have on how long we need to follow these patients who had lobectomy. But I think that's an excellent question. It's just the fact that there's been a sort of a shift in management, and we haven't had time to catch up to like how should surveillance, our long-term survivorship care change